The Democratic Republic of Congo is battling a new outbreak of the Ebola virus in the northwestern part of the country. A new outbreak of Ebola was reported on Monday with 4 fatalities so far. The country is still trying to stamp out an Ebola outbreak from 2018 and is now also battling a massive measles outbreak as well as COVID-19. The new Ebola outbreak is in the western city of Mbandaka, the capital of the Equator province. The city is situated at the junction of the Congo and Ruki rivers and is a major trade and travel hub and home to more than 1 million people. On Monday, officials confirmed an outbreak with 6 cases so far. 4 of the cases have died and 2 are being treated. The World Health Organization reported that officials expected to find more cases as outbreak responses ramp up. The outbreak is the 11th recorded in the DRC since Ebola was first discovered there in 1976. Well, for more on this, we've invited DRC journalist Aime Zonveni to join us and talk to us via Skype, and he's in Lubumbashi. Thanks so much indeed for joining us on the program. So this announcement was made on Monday. What do we know since then? It's been a couple of days. Have there been more cases and fatalities, perhaps?
No, and thank you for having me on the program. So far, no more cases have been reported other than the 6 that have been initially announced. And from Kinshasa, the National Institute of Biomedical Research, which is the country's main medical research body, has deployed a multidisciplinary team to Mbandaka to try and investigate more on this latest outbreak of Ebola.
So I suppose the authorities are concerned of where the location, because you've got, I think, the borders with Congo-Brazzaville on the one side and the Central African Republic to the north, and also it's on a busy route with close links with Kinshasa. So this must be a concern for the authorities, that the likelihood that it might spread further than just this area.
Yeah, absolutely. Unlike the 10th outbreak which happened in Eastern DRC and which happened in the context of insecurity, in the northwestern province of Equator, which actually is the former province of Equator, the potential for the outbreak to spread is quite real, not only within the DRC, but also across to next door Congo, Brazzaville, and also to neighboring Central African Republic. And I think that is really of concern to the DRC's health authorities. And that's the reason why the INRB, which is the medical body, has immediately dispatched that team to see how it can be contained. And lucky enough, unlike previous outbreaks, at least now there are 2 medicines that have proved effective and that have been tested in a trial in the 10th outbreak, which happened in Eastern DRC. And I think the health ministry will envisage using those medicines to try and counter the spread of the Ebola further across the country and further beyond the borders of the country.
All right, so most of us are now very focused on COVID-19. Just remind us again, what is Ebola? How does it present and how contagious is it?
It's extremely contagious, and the contagion happens by physical contact with people that are infected by the virus. And once you have come into contact with the body fluid of a person that either died of Ebola or that is contaminated, that's how you catch the disease. And it also that's how the disease gets spread to more people. So key amongst the efforts that the Ministry of Health will have to undertake will be to try and track down all the contacts of the 6 people that have been identified in Mbandaka and see how they can contain them and see how these people can be placed under medication to try and contain the spread of the outbreak.
All right, on top of this, you've got COVID-19 to worry about as well. What's the situation on the ground in DRC with respects to the COVID-19 pandemic?
Well, based on the latest report, which was disseminated by the response team as of yesterday, there has been an additional 169 new cases, confirmed cases, which then brings the total of the country's cumulative total to 3,494 cases. And out of those cases, those confirmed cases, there have been 492 fatalities, and mostly more than like half of the provinces of the countries, the 26 provinces of the countries, are, as we speak, infected or affected by the pandemic.
So is this something that's increasing, that's getting worse, or have they been able to slow down the infection rate? What kind of interventions have the authorities put in place there?
Well, since the first case was confirmed in the country, which was back on the 10th of March 2020, the government has initiated a certain number of measures which actually mimic the measures that are taken in other countries, including locking down the capital city of Kinshasa, where the first cases have been confirmed, and also banning travels between Kinshasa and the remaining parts of the countries, and also other measures such as of late, the obligatory wearing of masks. But still, it's observed that on the ground, those measures are not very strictly observed by the population, because we're living in a country where people live on a daily basis, and they need to go out to try and make a living. So it's very difficult to try and lock down and the population. And that's the sort of measures that the DRC government has taken, even though now it is being said that some of these measures might be lifted. For instance, the travel bans might be lifted, as it has been recently reported.
All right, and measles is another problem that the DRC is facing. Tell us a little bit about that situation.
That is also actually, the DRC seems to be confronted to the those various epidemics at the country, and the measles also is very rampant in the country as we speak, on top of COVID-19 and on top of Ebola. And it is, at least for measles, the campaign of vaccination is ongoing, and therefore the capability of the countries to contain the disease is a bit stronger than would be the case for COVID-19, where we do not have any vaccination or medication, and unlike also Ebola, where at least now there are some effective drugs and effective vaccines.
All right. So, I mean, with all of these health issues to contend with, how resourced is the DRC in terms of health facilities to cope with this onslaught?
Unfortunately, I have to confess that the DRC's health system still has a number of weaknesses, inter alia, lack of appropriate care mechanisms in the hospitals, and the country is so vast. And for instance, the only COVID-19 sampling center where the samples are being sent is found in Kinshasa and in a couple of other provinces. This alone is a major challenge to the already complex situation that the country has been grappling with.
All right, and getting back to the Ebola scenario, so northern, southern Kivu, I believe on May the 20th, that's when they started counting down. Hopefully 42 days after that, they might say that the outbreak on the east has been dealt with. Are there any signs that that is still in force, that there are no new cases in that part of the country?
Well, if you look at it from the perspective of the 10th outbreak, which happened in the Eastern DRC, yes, the countdown started as of May 14th, so we're expected to see the official end of the 10th outbreak on the 24th of June. But if you look at it from the perspective of the entire country, then maybe this could again delay the process of declaring the DRC as a country free from Ebola. And from reliable sources, the medical research center in Kinshasa is now trying to decide whether they should consider the outbreak in Mbandaka as a new outbreak, and therefore those tests are being conducted to see if the case in Mbandaka is a new strain of the virus, or is it a resurgence from what has happened there 2 years ago, or is it related to the case in Eastern DRC? It's only when they make that determination, then they will decide on whether the case in Mbandaka is indeed the 11th outbreak in the DRC, or if it is related to the outbreak in Eastern DRC. And if such is the case, then I think the countdown to the 24th of June will eventually be delayed.
All right.
Or extended.
Okay, mon frère, that's where we're going to have to leave it. Thank you so much indeed for that comprehensive update and your insights on the situation, health issues that the DRC is facing. Thanks so much indeed. À bientôt and au revoir.
Here is my au revoir.